Hi, I'm Dr. Ranjani Rao, practicing general dentist and an implantologist in Electronic City, Bangalore. We run two state-of-the-art dental centers in the region of Electronic City. We've been doing this for the last 15 years. I think the question should be, what is the best option for you to replace your missing teeth? Because it varies from patient to patient, scenario to scenario, depending on whether it's a front tooth or a back tooth, if it's one tooth missing or multiple teeth missing, if there are crowns in the neighboring region. Depending on all these factors, depending on your general health, if you are a diabetic or not a diabetic, if you are on bisulphates, for example, if you are an elderly person with osteoporosis and the doctors have given you medication to keep your bones harder, all of these factors play a role in deciding if you are a candidate for replacement. Can we replace it with implants? Can we replace it using bridges, fixed? Can we replace it using, say, a cantilever with just a wing if it's a lower anterior, not a load-bearing area? Can we replace it with conventional dentures or use alternatives like flexible dentures or cast partial dentures where we use metal cast components in the denture which makes it that much more lifelike? So, every case, every tooth has to be customized in terms of treatment plan depending on the existing situation, your medical health and your primary requirement. Right from whether you're a vegetarian or a meat eater, the treatment plan will vary. So it's extremely important to sit down with your dentist, explore the options and arrive at what is best for you for that situation.